but let's just focus first on healthcare and trying to address the issues of those that continue to struggle to access and afford healthcare. I'll just remind you, past actions, no one else in the country, no other state in America has done more in this space than the state of California. It's a point of pride in the last few years in particular. It's a point of pride and passion as well. That said, we're not nearly where we need to go. And that's why we'll talk about our new investments, but just briefly, middle-class tax investments. You may recall the middle-class subsidies we did a couple years ago. No other state had done that. Interestingly, because of Nancy Pelosi's leadership and because of the president's leadership, they are actually now subsidizing that space. So we have roughly 300, Keely will clean this up perhaps after the presentation, but $333 million of savings because we don't have to fund that middle-class subsidy that we'll be putting into a reserve fund to expand other subsidies. But it's important to remind people that we were the first state to do that. We expanded ACEs screening, dementia screening. That's $135 million over 3 years alone. We launched CalRx and Medi-Cal RX this year, and I'll talk a little bit more about a preview for next year to attack the issues and costs associated with prescription drugs. And we expanded coverage for people regardless of immigration status, young and old alike. This year, here's what we're proposing to do. We struggled last year a little bit, and I'm not shy to say that, and I'm actually really proud because we had a great conversation with the legislature on creating this new Office of Healthcare Affordability to address underlying cost drivers, compliance, integration, again, of primary and behavioral health issues that we all share. I'm looking forward to getting this office done. It's been stubborn. It would have been done before if it was easy. So we are proposing to get it back this year. Here on the CalRx, insulin. So we decided just to chunk this thing down. How can we lay the groundwork to start manufacturing, or at least partner with manufacturers to do our own branded pharmaceuticals? We're just too big not to do that. Private sector uses leverage. We should use private sector considerations to leverage our purchasing power. Now, we've done that with private sector folks that now can join the state plan. That was part of the original CalRx and original executive order that I signed. I think that was one I signed on the first day in office. But we've been focusing on a partnership. You asked me about it. I'm not going to share any details until we're ready, but I wanted to preview it. And that's to contract and manufacture our own insulin at a profoundly reduced cost. I'm so excited about this. Can't wait to share more detail. And full disclosure, I don't think my staff was particularly pleased that I even offered this much information, but I wanted to lean in because I want you to know we mean business in this space, and I'm not walking away from that long-term commitment to get pharmaceutical costs down in the state of California. And by the way, I think insulin epitomizes the failures in the pharmaceutical industry. It just, in every way, shape, or form. And that's why we're targeting insulin, and we've got a potential partner, and looking forward to advancing more information in that space. Look, more things we've been doing and things that we're building on this year, part of the California Blueprint moving forward. We have more ideas, and Keely can walk through the details, to reduce premiums for pregnant women, children, new moms, those that are disabled. A lot of investments in the reproductive space, more flexibilities, more investments in terms of security broadly to provide safety and security and access to reproductive health in this state. We're looking to more investments, providing more equity for provider payments, particularly for preventative care that has been impacted by COVID profoundly. So real investments in that space. And opioids. I talked a few weeks ago, I'll talk very briefly about it in public safety slides coming up, around what's happening with fentanyl in this nation, what's happening in this state, this opioid crisis. A disproportionate focus of those resources, $182 million, will be in that fentanyl space. And we also will be focused not just on medication-assisted treatment, but also on issues of enforcement. But here's the big one. California is poised to be, if this proposal is supported, the first state in the country to achieve universal access to health coverage. So what does that mean? It means full scope Medi-Cal, including long-term care, IHSS, behavioral health, to all low-income Californians, regardless of immigration status, regardless of their age, regardless of their immigration status. Full implementation will initiate January 2024 if this is approved. I want to thank Senator Durazo, so many others, Arambula, so many leaders in this space. There are strong advocacy for decades, even prior to those leaders, decades, those that have been advocating for universal coverage. We're going to do it. We said we're going to do it. We said it would take a few years. We're committed to doing it. $614 million, it's not on this slide, $614 million is the general fund for this 2022-2023 budget year, and it annualizes at about $2.2 billion general fund in the out years. So 614 in this budget year, 2022-2023, annualizes $2.2 billion into the future. Building on that, want to remind you of some of the past actions we've taken. Again, big part of our focus, and we'll talk briefly about it here in a moment around CalAIM, is the integration of brain and physical health, integration of mental health and substance abuse, issues of integrating around the whole person, meaning as an individual with so many comorbidities, so many challenges that make us human, and opportunities to address. So much of that integration is a big part of our focus. That's why transforming our behavioral health system is so foundational. This no wrong door policy, which will be part of all of our contracts, I think by July. We can get Dr. Galley and others to follow through in more details on that. We also committed, as you saw, to more facility investments in the last couple of years, more focus on crisis centers, peer supports, but also reimagining our children's behavioral health. And this is so exciting. It really is. No other state, I don't know, maybe there are, to be fair, but I haven't been reading about a lot of other states that have committed, except rhetorically, to investing 0 to 25. Well, $4 billion to completely reimagine our screening and services for our children. I mean, I don't need to tell you the stress and the anxiety that our kids have been under over the last few years, particularly as it relates to COVID. This is serious, and we are taking it seriously, and there's $4 billion in multi-year investment in this space. Last year, we put $1.4 billion, and this year, year two of that $4 billion investment is an additional $1.5 billion for our kids. And that's, again, an exciting proposal. It connects dots in our school system, and that's a multi-year vision that we are doubling down on. Speaking of $1.4 billion, I mentioned this a moment ago. We're creating this brand new Medi-Cal benefit for community-based mobile crisis intervention services. Again, this could easily be in that homeless bucket, but I wanted to include it more broadly in the healthcare bucket since it is a Medi-Cal benefit expansion. $1.4 billion. Deal with those in crisis, mobile units, intervention, out on the streets. Very exciting proposal. And one that is long overdue in the state, as is the focus on those that are decomposing, those that can't represent themselves, those that need stabilization and diversion to the extent they can, that are found, quote unquote, incompetent to stand for trial, what we refer to as ISTs. I can go into great detail on this, but suffice to say we have a responsibility as a state to do better in this space. We haven't. We own that. And this is a commitment, firm commitment. Dr. Galley's one of his top priorities, and that's reflected in the budget investment our state hospitals here. Briefly, just on CalAIM, we've talked about it in the last few years. For those that say, well, more is not better, better is better. For those that say, boy, what are they doing about reforming their healthcare system that has about 14.5 million Californians, a third of their population? Well, this is what we're doing. We're reforming the Medi-Cal system. Reforming payments, reforming our entire approach. It's called CalAIM. We got the Biden administration to support this effort. That wasn't easy. Easier, the Biden administration, but not easy to get the federal government to sign off on first-in-the-nation reforms, true whole-person care, better coordination, not just short-term, but long-term care. This is exciting. All the justice-involved populations, folks, before they get out of jail, county jail, we actually are going to make sure they're screened for Medi-Cal eligibility, fill out a form, and learn that they actually can avail themselves to primary and preventative care. So they don't end up out on the streets and sidewalks. Health equity, I mean, you see the whole gambit. And so this is year 2 of this multi-year commitment, $2.8 billion this year to move the needle and to advance these, as we love to say, at once in generation reforms. I'm mindful of time, so let me be brief, though housing could take more than a week in terms of presenting what needs to be done and the magnitude of the crisis in terms of costs in this state. We put out last year something we had never committed to, and that's a long-term vision with long-term investments, $10.3 billion. This year we want to add an additional $2 billion